Hello, everybody. I see we're coming up to the hour, so I'd like to start our meeting. We would like to begin by welcoming everybody to the June Open Virtual IAEG-SDG Meeting, our second of the year, 2022. So good morning, good afternoon, and good evening to everybody. My name is Kevin McCormick. I'm a member of the IAEG-SDG. I'm also co-chair of the IAEG-SDGs Working Group on Geospatial Information, the WGGI. Today we have some discussion around COVID-19, and I'm also the co-chair of the tag on the WHO UNES tag on COVID-19. So our program will include an update from the IAEG-SDG, co-chair on the work of the group that is planned for 2022 to 2023. Then we will have two sessions, the first focusing on data, COVID-19 and the SDGs, and the second focusing on SDG progress and the challenges of the goals under review at the high-level political forum. So we're looking at goals 4, 5, 14, and 15. Each session will be followed by a short Q&A. Please remember to submit questions in the chat, and if possible, to whom the question is for. Now we are looking at our first speaker. I think it's Karen Chavez of Colombia. Karen, of course, is co-chair and my boss here, of course, of our IAEG-SDG, and she will give us an overview of the UNSC 53 decisions and the 2022 to 2023 IAEG-SDG work plan. I see Karen is there. So Karen, over to you, please. Thank you.
Thank you, and thank you so much, Kevin. I'm going to present now the overview of the UN Statistical Commission that just occurred this year during March. And these decisions are mapped in the IAEG-SDGs work plan. I'm doing this presentation on behalf of the co-chairs. So also as co-chair is Cara Williams from Canada. And now I'm going to give this presentation. Thanks. Next, please. Okay, so we have in our work plan 7 areas of work. Each area of work is identified by the letters A, B, C, D, and each area of work has some activities. So the first area of work is about the indicator framework implementation. And here we have the following activities. The first one, update good practices on SDG monitoring website, including collecting good practices on data innovation from countries. Then also we have a capacity building needs already identified with the HLG and the CCSA. And just a reminder that the HLG that we are referring here is a high-level group for partnership coordination and capacity building for statistics for the 2030 Agenda for Sustainable Development. And the CCSA is the UNSD Committee for Coordination of Statistical Activities. So some capacity needs have been identified, and it is supposed to share these needs. Also, there is a liaison with the HLG on activities on financial support for SDG monitoring to expand the dialogue. And we have also planned to develop a questionnaire to compile capacity building and training programs on SDG monitoring and develop an online platform of these materials. And the next area of work is about the methodological development and metadata review. Here we have the following activities. The first one, continue the review of any updated metadata with significant change in methodology. And we also have the metadata subgroup that continues its activities of reviewing all metadata to improve the quality of the metadata. And also we have planned to liaise with custodians on the e-handbook. Next, please. The third area of work is about data disaggregation and a small area estimation. This is quite relevant for us given the leave no one behind. So it is needed to update the data disaggregation good practices on the wiki platform That is the website of the IAEG-SDGs. So here in this web platform, you can also find all the resources in a digital form, and it's available 24/7. Also, we have planned to continue the small area estimation for SDG support to countries via e-learning and capacity building, considering that these small area estimation methods are kind of new. Some additional capacities in national statistics institutes are needed. Also, the working group on geospatial information has created a task team on data disaggregation to inform and engage with the group. This is mainly related to disaggregations at subnational level. The next area of work, it's related to the IAEG-SDGs working group. We currently have 2 working groups, the geospatial working group and the SDMX working group. And continually, we are reviewing the work plans for additional activities, and also these groups are carrying out the work programs. The next activity, it's the dialogue with custodians and data flows. We have established some regular meetings between the IAEG-SDGs co-chair with the CCSA UN co-chairs to discuss issues raised by countries in terms of the requirements that custodian agencies make to countries to compile data of SDGs. And of course, bilateral meetings with custodians as needed. Next, please. And the last 2 areas of work, we have here the meetings and the working modalities. The IAEG-SDGs hold monthly meetings. Some of these meetings are like this one, are open meetings, and we try to have periodically open meetings with a reminder that the next open meeting is going to be the 13th meeting of the IAEG-SDGs in October or November, with the possibility that this be a physical meeting. And the last activity is some specific indicator issues. Here we have 2 issues. The first one is related to the target 8.9. So the IAEG-SDGs is going to establish a task team for development of methodologies for indicators on sustainable tourism to ensure that they are ready for submission for the 2025 comprehensive review. And also we have an issue with the indicator 17.3.1. UNCTAD is going to lead further work on South cooperation conceptual framework and report to the IAEG-SDGs on progress. And also UNSD is going to support countries on further review and include update of the United Nations Statistical Commission of the next year. So with this, I just want to say thanks to all of you for joining, and back to you, Kevin.
Thank you, Karen. We're very tight for time, so we might be able to take maybe 1, maybe 2 questions at the most. So we can ask most people if they have the questions to put it in the chat, and we can ask Karen to reply. So if anyone has a question they'd like to raise, if you want to raise your hand, we can take maybe 1, maybe 2 at the most. Okay, I don't see any hands up. Okay, so we might just refer that to the chat. So if anybody can think of additional questions, they might just ask Karen in the chat. So thank you, Karen, for that very informative presentation. And it will be good to have a physical meeting if we can this year. Thank you. So we move then to our next agenda item, which is the data, the COVID-19 and SDGs. We're looking here at, we're going to have 5 presentations in total, and we'll have a Q&A again to follow. Again, we can say, please submit any questions in the chat. We'll try to cover as much as we can during the Q&A. In case we do not cover anything, I would encourage speakers to also answer questions via the chat. So our first presenter is William Messenbury. and he's a technical officer at WHO, the Division for Data and Analytics. He's the lead analyst for the excess mortality estimation that the organization has been pursuing. He has a background in statistics and demography with a PhD in global health measurement from University of Washington. With that, I'll hand over to you, William. Thank you. Please take the floor.
Great. Thanks very much, Kevin, and greetings to everyone. So over the next 15 or so minutes, I'm going to outline what we've been doing, looking at COVID mortality and excess mortality in particular. And this is work that is supported by a technical advisory group, which Kevin is a part of. So I'm representing a large group of people when I present this work. You can go to the next slide, please. So as an outline of my presentation, first of all, I'll talk about the reported COVID-19 death numbers, and we'll compare that with excess mortality, which is a different metric to just reported COVID-19. We'll also go into the concerns we have or the challenges we have when we try to estimate excess mortality, the main one being the data that are available. And then we'll talk about the advisory group and their input into the methods we're using. After that, I'll go into the methods themselves. How are we estimating excess mortality? And there's two key components to excess mortality. There's an expected number, what would have happened if the pandemic had not occurred. And then there's predicting the actual deaths for the countries without data. I'll give a very brief overview of the results, and then we'll go into a discussion. Next slide, please. So when we look at the reported COVID-19 numbers, so this is dated from last week when I sent these slides. As of the 10th of June, there's over 500 million COVID-19 cases that have been reported to WHO and over 6.3 million deaths. So the deaths that are reported are concentrated in 3 regions. And these are the WHO regions: 44% the region of the Americas, 32% Europe, and 13% in Southeast Asia. So this is about 89% of all total deaths concentrated in these 3 regions. We also look at the World Bank income group slides. 83% of them are concentrated in upper middle income and high income economies. That's 44% upper middle income and 39% high income. These 2 plots that I'm showing on this slide, they show again the WHO regions, and then they also show the countries that are contributing the most when it comes to the reported COVID-19. And then you also have on the right this whole time series of reported COVID-19 deaths. So we do see this concentration in Europe and the region of the Americas, and we see particularly in 2021, right at the very beginning there, when Delta wave began, this surge happening in Southeast Asia, in particular in India. Next slide, please. Now, the problem with the reported COVID-19 numbers is that they do not give us a complete picture or a full picture of the impact of the pandemic. And there's a number of reasons for this. So the reported COVID-19 death numbers underestimate the lives lost due to the pandemic, and this is a generalization. They miss the unreported COVID-19 deaths due to variations in testing access. So even from when the pandemic began, countries have had differential ability to test, to diagnose, and in terms of how ICD, which is the International Classification of Disease, rules were being applied to define COVID-19 deaths, these were applied differentially across countries. So because of that, then we have differences in the quality when it comes to the reported COVID-19 deaths across countries. The reported deaths also miss increases in other deaths that are linked to conditions that have prevailed since the pandemic began. So we have seen reports of overwhelmed health systems or patients avoiding care, and this has also had a knock-on effect and with deaths increasing. And so because of the reported deaths having these quality issues, we've been leaning on excess mortality. So excess mortality is crucial for us fully quantifying this impact. We define excess mortality as the change in all-cause mortality for specified location and time when you compare the deaths that have occurred to those that were expected to occur in the absence of the crisis. So our excess mortality measure encompasses deaths from all causes. So it has the direct COVID, the indirect COVID, and other diseases. And it gives us a measure of the whole system impact. The challenge with tracking excess mortality globally is that timely, reliable, and complete data are limited. So only a subset of countries have complete electronic medical certification and fully functioning CRPS system. When it comes to WHO, we have observed a lag of more than a year after the end of a calendar for countries to submit cause of death data to us. And attributes such as sex and age are missing from data from many countries. And you'd be aware that these are critical attributes, particularly in tracking SDGs. Next slide, please. So what I'm showing here is a map that really to outline what I've just described about data availability and data quality. So the places in the purple color, those ones are the ones for which the countries for which have full national data and were able to track excess mortality more or less directly. And then we have some countries that are sort of partial national. So these are the ones in the purple. So the navy blue, full national, the purple, that's the partial national. The green, those are countries that have some subnational data or annual data. So this data would not be, subnational data would not be fully representative of the country. And then the countries in yellow are countries for which we do not have data. So we don't have representative data that can be used to track excess mortality for those countries. So if you look at it in terms of the proportions or the WHO regions, for Afro region, we only have full national data for 4 countries out of 47. For AMRO region or region of the Americas, 8 out of 35 countries we do not have data. The country for Europe, we have the largest proportion. So we only missing data for 1 country, but you can see the huge gaps for Southeast Asia, Western Pacific, and particularly the African region. Next slide, please. So in response to the data gaps and the need to actually track excess mortality for us to capture and understand what was happening with the pandemic, the WHO and UNDESA established a technical advisory group. So the purpose of this tag is to look at what are the alternative sources of data, how can we best use the data that are available, and what are the best methods for us to estimate excess mortality considering the data paucity. So the tag is made up of 33 members and over 30 observers, and these are experts in epi and data science, analytics, statistics, biostats, demography, and we also have some national governments represented, academia and policymakers. And as I've said, the terms of reference for the tag are to look at what are the best methods, best sources of data, best statistical models for estimating COVID excess for January 2020 to December of 2021. So we will, for the next few slides, then I'm going to talk about the methods that have been used for the expecteds, methods that have been used for predicting all-cause mortality, and also the methods that have been used for some of the places with only subnational data, including India. Now we can go to the next slide. So for the places for which we do have data, I'm just taking note of my time, we are using a statistical model that takes into account the annual variation changes over time in when you look at the year or annual change, and then also the seasonal variation. So we're using a negative binomial model, which is a count process statistical model, which has a parameter for over dispersion, which means for the difference between this, the mean and the variance. So basically, normally in your Poisson models, you're assuming that your mean and variance are equal, but with a negative binomial, you can relax that assumption. So we predict our, if you look at this plot on the right for Bulgaria, for example, the green line, that's your expected, and that's come from a statistical model that uses historical data on the annual and the seasonal. We can go to the next slide, please. So for the places without data, we are as well using this whole idea of a Poisson model or count model, where we are relaxing the assumption about the mean and variance being equal. So we're assuming that the observed deaths, which are parameterized here with the capital letter Y, are a function of the expected deaths, which have this E, and then a parameter theta, which is a scaling factor. So really we're just saying your actual deaths in the year are your expected deaths multiplied by some scaling factor or relative rate parameter, which quantifies the impact of the pandemic. Next slide, please. When we're looking at this relative rate, we're using log relative rate, we're using a statistical model. So our theta, in this case, the log of theta, is equal to an intercept, and then it's a function of some variables that change over time, which are, in this case, we have capital letter B for representing them, and then some variables that don't change, which is capital letter G. So really we're saying, you know, the scaling factor that we can use to multiply our expected deaths, let's relate it to things like reported COVID-19, testing, stringency and containment measures, and that's also related to characteristics of the country. So is it a high income country or is it not? What was the human development index value? What were the levels of diabetes, cardiovascular? What is the age pattern of the country? So using this logic that the log derivative rate can be fitted as a function of time variant and time invariant variables that are specific to the country, we're able to quantify and measure the scaling factor for to predict for those countries that don't have. And then you see this model is fit using data from countries with good systems. Next slide, please.
Sorry, William, you have 2 minutes. Thank you.
2 minutes. All right, just to highlight for subnational data, so this is the model that's been used for India. We've taken data from 17 states, and we've looked at the proportion of the national that's made up of these states. And then those states have data within the pandemic, and really we're able to scale up what's been observed in those states to get the national. So all of it has been empirical, although this has been disputed by India because they did not supply us with the subnational data. We had to find it from other sources. I'll just share 2 more slides. The next slide shows the estimate, 14.9 million. That's the global number relative to 5.4 million, which is the reported COVID. And then we can go to the last slide, please. Yeah, so just to, these estimates can be viewed. There's the link, World Health Org, Shiny Apps, COVID Excess. You're able to go to that website to view what's been done. This work is iterative, which means we'll continue to update as we get more data from countries, as we look at the strength of the model and we're able to validate it. This is not a one-size-fits-all model. We use all the data that are available that we can find. primary data for some countries, subnational data for others, and then this predictive model. And there are limitations. Depends on the quality of the inputs, depends on how consistent they are when we take it from countries with data and apply it to countries without. It also depends on how those relationships have changed over time. But we have used the best available methods and best data, and we'll continue to update. Thank you for your time. Over to you, Kevin.
Thank you, William. Thank you for your presentation. As we're tight on time, we'll just move straight into the next one. So our next presenter is Joseph Salvo. Joe is an Institute Fellow with the Biocomplexity Institute, an initiative at the University of Virginia. His work has been crucial to the formation of more widespread evidence-based policy, as his expertise in census data history, methods, operations, and products makes him uniquely able to analyze demographic data and explain this information to policymakers, who are in turn able to understand and apply this data during policy formation. For more than 25 years, Dr. Salvo was the chief demographer for New York City in the Department of City Planning. Joe, can you please take the floor? Thank you.
Thank you very much. I'm here, I'm part of a team at the University of Virginia, working with the US Census Bureau on a new framework for curating, integrating, disseminating data. It's the framework of the future, and it has a real applicability to much of what the SDG initiative is about climate change, emergency preparedness, a whole series of equity and inclusion issues, vulnerable populations. It is a method, it is a framework, excuse me, that is applicable to a whole series of scenarios, much of which the SDG initiative deals with. We have so many items in the headlines that involve societal changes. The pace of change has been extraordinary. We have economic issues involving, from the pandemic, involving so-called gig employment, where people have multiple jobs with multiple employers, shifting, attempting to make a living, to make things work. And there are migration patterns that we've had to observe, or that we want to observe as a result of the pandemic. And the headlines pose all kinds of dilemmas for local people trying to make decisions about their communities, about their neighborhoods. In the US, there have been patterns that show a large, perhaps an exodus from cities, but on the other hand, movement has slowed historically over time. And then there are vulnerable populations, and the headlines have been filled with issues involving nursing homes and the dilemmas faced by nursing homes. And in a few minutes, I'm going to talk about that specifically as a case, a use case for the curated data effort. But let me first begin by telling you a little bit about what's called the curated data enterprise. What we're talking about here is the use of data that can inform decisions and provide metrics to evaluate progress. The CDE, as we call it, or Curated Data Enterprise Framework, is a process to guide, potentially guide, SDG implementation and evaluation. It gives us the ability to empower professionals, people, for example, at the US Census Bureau, scientists, utilizing a model, utilizing a framework that integrates multiple data sources, curates those sources, provides data, and measures ultimately that can prove to be far more robust. The CDE framework is comprehensive, rigorous, and disciplined. It's a foundation for implementing strategies to address some of the problems I mentioned earlier, some of the issues that were mentioned earlier. The goal is to illuminate here. I want to show how the CDE works. I want to show why it's relevant potentially for SDGs. this process involves information collection, curation. It starts with the purpose and use framed as research questions, as you see in the chart here, and working hypotheses, and continues through each of these steps from data discovery to each of the data analytic steps. At each step, there's curation, communication, and dissemination of results. And there are reviews of ethics and equity at each of these stages. The process is iterative, it's not linear. The framework is important as a guide for the research and implementation of the curated data enterprise. It provides insights into creating standards and hopefully can become automated at various points. Now, I've spent my entire career as a local demographer. I've been fortunate to be involved in hundreds of data applications aimed at helping, in my case, New York City agencies, nonprofits working in New York City, and other organizations to help address issues of concern about the neighborhoods of New York. Now, New York City is a big place, but it is composed of several hundred smaller places, smaller neighborhoods, communities, where local decision-making has its main impact. The applicability of the CDE has to be local. And you can see here in the chart, 70% of the areas designated as places, about 32,000 in the US, have fewer than 4,000 people. Local planners have to make decisions. They are consumers of data, but they also direct decision-making. So they need to put their resources to work. The same thing applies across the world. Local is where it's at, so to speak, that you need to have local decisions that are informed by data and to mitigate the effects of everything from problems involving water resources, emergencies involving climate change, changes in the economy due to the pandemic. So in many ways, we have to think locally. Now, in order to do this, to think like a local, we want to have some illustrations here. There are 3 knowledge areas I want to talk about, one of which I'm going to focus on. The local economy, what do residents need to do within the pandemic, the environment posed by the pandemic, in order to survive economically. What is happening to migration, as I mentioned before. I like to think of it as people who are reacting with their feet, it's movement. What about those who are most vulnerable? In this case, nursing homes. I want to focus a little bit on older populations because this is a problem throughout the world. We know about the issues involving aging and involving things like issues like nursing homes. And residents of nursing homes are among the most vulnerable populations. And there are a lot of rich sources of data that exist in the US regarding nursing homes. Nursing homes are businesses. Nursing homes have workers. Nursing homes can be evaluated from the standpoint of jobs and recruitment of workers. And of course, there's the whole geospatial element of where nursing homes are located. Now, in the US, these data exist. There are a number of places where you can get information, but there has, as of yet, no source, no framework to bring together this information, okay? The partnerships that need to be developed in order to do this. The integrating data that frequently have different units of analysis, different timing, different geography. So what I offer to you today in the form of this rather ominous looking chart, but actually this chart is actually in some ways quite basic. As I said before, if we use this framework to try to get a handle, in this case, on a severe climate event that is affecting nursing homes, let's say, okay, we need to provide a data product for the local decision makers to use in order to effectively, for example, make a decision about mitigating a serious impact on those nursing homes. Now, we know that senior populations are vulnerable. Nursing homes are businesses, as I said before. There are workers. There's data about people, and there's data about their location. On the left, you see these are called frames. The Census Bureau is already linking, the US Census Bureau, linking these frames together to create a data set that is then brought into the environment of what we call the curated data enterprise. That environment integrates, curates that data, but it does more. It brings in data from external sources. There are agencies and quasi-government agencies that produce information in the US. It's the Center for Medicare and Medicaid Services, the Centers for Disease Control. These agencies have data that need to be integrated or brought in. Now, that's not the end of it. What you then do in an interactive platform available to local decision makers, you then bring in other information about nursing homes and their engineering elements, the elements that involve facility safety, that involve your capacity to deal with a climate event, in this case, a severe climate event. What about the safety protocols? What about the engineering protocols? What about local transportation infrastructure? Right now, I'm working with some cities, in one case, the city of New Orleans, to try to see what kinds of local data they have that can be brought into the CDE. The local data involving, in this case, a database that they've created on emergency preparedness, where facilities report to them about evacuation plans, about their capacity to deal with climate events, about their transportation networks. In New York City, evacuation from coastal areas becomes very, very important in this situation. We need to bring in data linked to the data that you see here in that box in the middle, the baseline curated data enterprise, integrate it, and then provide it on a platform so that a local decision maker could come to that platform with their own information and integrate it with the data provided, in this case, from this framework, from this curated data enterprise. And what you end up with is a product that can produce a data foundation for a decision. Pure and simple. It's the CDE provides the governance for the creation of that final product on an interactive platform, which can be made available to local decision makers. The big issue right now is how much automation can you incorporate into this process? Because you need to do that in order for this process to ultimately provide us with the kind of output that I've described. Let me give you another case. This is a case in New York City, and it's a case of New York City using data creatively. In this case, changes of address provided by the US Postal Service. Sounds pretty basic, and it is. If you see the chart on the left, what you have is you're capturing movement, okay? Movement that's useful in something close to real time. Right now, we do not have very good real-time measures of migration, okay? The address data allows you to look at month-to-month changes, in this case, for the 5 boroughs of New York City, and you look month to month and you see that drop in Manhattan. With that drop in Manhattan, 2 minutes?
Yes, Joe, 2 minutes,
Okay.
Thank you.
What that drop in Manhattan indicates is that Manhattan did experience a large-scale movement out as a result of the pandemic. In real time, you could see this. For the most part, these areas are places where people have economic resources and they have options to move. Again, the US Census Bureau has a large amount of data, and we know about year-to-year changes, but now we need to know about month-to-month changes. As many of you on this call likely know, cell phone detailed records are being used throughout the world now, especially in the nations of Africa, to track interregional migration. This is something that the Curated Data Enterprise can certainly work on or sponsor or help forward. In this case, we've got some real-time information. The map on the right shows you those dark areas are areas that had heavy losses. For those of you who don't know, that is Manhattan, and you see Western Brooklyn experienced also losses. Again, these are people with resources to be able to do this. Many neighborhoods in the city could not do this because those resources don't exist, bringing forth the issue of equity. Let me say in the end here, we call it the art of the possible. The goal is to have evidence-based decisions based on more timely data, data that is a product of this integration and curation that I've discussed, and data products that are actionable at a local level. There is our website. I will make these slides available. The University of Virginia Biocomplexity Institute is the team essentially that is working on this. I am part of that team. And here is my email. If any of you would like to pursue this further, I'd be happy to answer any questions later. I want to thank the sponsors here, the host here, for inviting me today. I really appreciate the opportunity. Thank you.
Thank you, Joe, and thank you for keeping to the allotted time. Much appreciated. So next will be a joint presentation from Harriet Sdg Meeting, a senior economist and data scientist at the World Bank. As a member of the Living Standards Measurement Study, the LSMS team, Harriet has expertise in survey instrument development, field operations, data quality control, analysis of household and survey data. She will be joined by Omar Musa Ali, a social demographer, and currently the head of Department of Demography and Social Statistics at INSTAD in Djibouti. Over the years, he led the implementation of a great number of national household surveys and studies conducted in Djibouti on behalf of National Institute of Statistics, as well as UN agencies and other international organizations. Harriet and Omar, you have 7 minutes. Please take the floor. Thank you.
Thank you so much, Kevin. Hello, everyone. The presentation today is around leaving no one behind on national COVID surveys, inclusion of the forcibly displaced in nationwide phone surveys. And this is evidence guided by the international recommendations on refugees and IDP statistics. Next slide, please. So the World Bank, UNHCR joint data on forced displacement, the JDC, the World Bank and UNHCR in collaboration with other international organizations such as WFP, worked together and in close collaboration also with the national statistical offices to identify countries where they could conduct COVID-19 high-frequency phone surveys on the national, which we call host populations, in order to monitor the socioeconomic welfare and behavioral changes of households during the pandemic. Now, these, of course, surveys then were expanded to also cover one of the most vulnerable groups in these countries, which included refugees, internally displaced persons, and returnees in a representative and disaggregatable manner to ensure that they were also, we could also understand the dynamics of the pandemic on this vulnerable group, and also to enable now policies that are being put in place to be able to also target these vulnerable groups. Now, the JDC also has supported the analysis of the data that was collected during these phone surveys. Why phone surveys? As we know, during the pandemic, movement was restricted. And so the only practical way of collecting data and monitoring it in a timely manner was through telephone surveys where households were contacted via phone, and a series of questions were asked to them, and information was collected through the mobile or the phone device. Next slide, please. Now, which are some of these countries and populations that were captured, were included in the socioeconomic surveys? We have around 10 countries. There are more that are coming up now, but these are the 10 that that the data is already available and some or documentation as well. The ones that are in bold, dark black, are the ones where we worked directly with the national statistical offices, while in the other countries, the collaboration with the national statistical offices in some context was indirect. Now, as you can see, we were able to capture collect information on IDPs and hosts, host being the national, the non-displaced populations. And in some cases, we were able to capture information on refugees. Next slide, please. Now, what are some of the socioeconomic, the key dimensions that we were collecting information on? Now, of course, the key dimensions are linked to what are some of the shocks that were induced by the pandemic. On the one side, we have shocks that affected the income of households. And on the other side, we have shocks that led to lower living standards and conditions. So under income loss, we have labor income, we have non-labor income as the other aggregate where information was collected. And under the living standards or living conditions dimensions, we have food security and food access, healthcare and access to healthcare itself, and then education. And here we look at, of course, learning conditions during and after the pandemic. Next slide, please. So what are some of the key achievements that we had in this project? One of the biggest ones was the inclusion of these vulnerable groups in nationwide surveys. So through the high-frequency phone surveys, we were able to collect information jointly with the national populations on refugees, IDPs, and returnees. This data on refugees, IDPs and returnees is publicly available. It's published on the World Bank and UNHCR microdata libraries. So different stakeholders and relevant actors can access it and use it appropriately, either for research, but also for operations and policies. In addition to the data itself, we developed short briefs that were released immediately after each round of data collection, as well as reports that were documenting the key findings on the conditions of refugees and IDPs and returnees during the pandemic. These briefs are also published on the World Bank website and also on our JDC website, which I will share with you at the end of the presentation in case anyone is interested in accessing this documentation. In addition, another key achievement was us working very closely hand in hand with the National Statistical Office. So as I mentioned earlier, there were countries where we collected the data and did the analytical work directly and jointly and in a collaborative manner with the National Statistical Office. And this was very, very, very important. And then also another key achievement was the collaboration between different actors, different organizations, both from the humanitarian and also the development sphere. These included World Bank, UNHCR, WFP, as well as other local organizations that work in these countries and support the displaced populations in their host countries. Another important achievement was, of course, understanding the socioeconomic impact of the pandemic in the first, on this vulnerable group, and it being compared to the host communities. So in the briefs and in the reports, we're able to show and compare and to analyze the data and to showcase where how the pandemic has hit and has affected refugees, IDPs, and returnees, compared to the host communities where they actually live. And then last but not least is also we're able to implement the recommendations from both IRIS and IRS, which was also very, very important because it helps us in these countries to be able to collect the data in a systematic way and also to have it up to the standards that have been and the recommendations that have been put in place by the expert groups. last slide, please. So, so for further information, please feel free to log in on the Joint Data Center website. And also please feel free to sign into our newsletter where you can get updated information as some of the outputs from the data that we collected are still coming. We have Jordan, where data is still being collected and documented, and any other information around reports and work that other people are doing using this data. So please feel free to subscribe to our newsletter so that you can be kept up to date on the developments around this topic. Thank you very much.
Thank you, Harriet and Omar, for your presentation. So we move directly into our next presentation. So our next presenter is my colleague, Mary Smith. She's currently a statistician in the Sustainable Development Goals Division of the CSO in Ireland. As a member of the UNECE steering group, she contributed to the work on the second edition of the UNECE Roadmap on Statistics for SDGs, which was published in February of 2022. During the COVID-19 pandemic, Mary contributed to the CSO work, which developed the official COVID-19 data hub, developed from the SDG infrastructure, which we'd previously put together. Now, before handing over to Mary, just a reminder to submit any questions in the chat. Mary, please take the floor. You got 7 minutes. Thank you very much.
Thanks, Kevin. And you might send me a reminder towards the end. Welcome everyone to this presentation on the second edition of the UNECE Roadmap. So if I could have the second slide, please. So I was privileged to be involved with this roadmap with Tina Ling in the UNECE and her team. And this second edition was co-chaired by Renata Belak in Poland and Sarah Frankel in Sweden. So it was officially launched on the 2nd of February this year. And here's a link to the press release, which covers some of the main points, and the publication link is here on the UNECE roadmap. UNECE website for the roadmap. Next slide, please. So with the 17 goals and targets and with over 232 indicators, we can see that there are well over 1,000 data tables. And then if you break it down into region, age, gender, so on, and maps, there's multiples of this number. So you can see that there are a lot of statistical challenges facing the national statistics offices. Next slide, please. So this new roadmap, as I said, was developed by the Conference of European Statisticians Steering Group on Statistics for SDGs. It builds on and extends the first edition of the roadmap, which was very useful in helping national statistical offices to develop their SDG focus and their structures. And in this second edition, special attention is given to quality assurance and the underlying theme of leave no one behind. Next slide, please. So the roadmap covers areas where work is needed to set up and maintain an effective statistical system to meet the SDG data needs. And 10 key messages and recommendations were identified from this second edition. So firstly, the global commitment to the SDGs, the need for strong reporting and data sharing commitments was highlighted. Secondly, was the global list of indicators, and starting with this global list, there was a need for developing regional and national relevant in-depth analysis. So countries were encouraged to develop a national prescriptive list of indicators that were of importance to their country, because sometimes indicators at a global level may not really be relevant to a country. Thirdly, the importance of partnerships for localized data was emphasized, and this would involve working with civil society or local groups and also new sources of data. So the partnerships in developing statistics beyond the traditional statistical system was emphasized here. Point 4 looked at understanding the data in terms of the metadata. So when we publish data, we need to publish the metadata with it to explain the data. And then point number 5 looks at indicators beyond the conventional official statistics. So I have some environmental icons here just to emphasize that a lot of environmental data doesn't meet the traditional data table format that we are accustomed to in statistical offices. So examples would be Earth observation and satellite data. Next slide, please. Looking at number 6, legislative frameworks. So this is important in terms of having access to new data sources. So this should be regulated. Number 7 emphasizes the importance of the main information hubs, both in terms of reporting global data, but also in making the data available publicly and to the people who need it, such as decision makers. Point number 8 covers capacity development. So this should be a continuous process to make use of the new data sources and new technologies which are emerging. In point 9, it covered the pandemic. The COVID-19 outbreak emphasized the need to have a modern statistical system with innovative solutions. So this was particularly important when we saw traditional sources of data, such as face-to-face surveys and things like that, were not possible. And point number 10 covers the cooperation and partnership that we need with other groups and organizations, academia, private, public sector, and so on, to meet the requirements of Leave No One Behind in terms of getting access to data for vulnerable groups. Next slide, please. So in addition to the roadmap online, there are several case studies which are helpful to countries who want to develop their statistical system and in terms of national reporting platforms.
Mary, 2 minutes.
Okay, so you will see these available online, and there's a good examples from Armenia and Iceland, which used the first edition of the roadmap. Next slide, please. So very briefly, there's 9 sections in the roadmap. So section 1 refers to specifically to the importance of the official statistics and national statistical offices. Section 2 covers the quality, having guidance in terms of UN national quality assurance frameworks and making sure the quality data is available. Section 3 covers coordination and the importance of NSOs in coordination. Section 4 looks at the national reporting platforms and the importance of them, both in reporting the data globally, but also in making it available nationally. The SDG frameworks are covered in Section 5 in terms of the global, regional, and national SDG frameworks. Next slide, please. So the last 4 sections, firstly covering Section 6, Leave No One Behind, and the importance of disaggregated data. Section 7 emphasizes the importance of communication and advice on communicating the data. VNRs, voluntary national reviews, are covered in Section 8, and then Section 9 covers capacity development. Next slide, please. So the roadmap is available on the UNECE website, and promotional material is being developed by the steering group. So there's a link here to that, and please share it on social media and with your platforms so people can see what the roadmap provides and the guidance for countries in it. Thank you very much. Back to you, Kevin.
Thank you, Mary. Thank you, Mary. So now our last presenter for this part of the meeting is Fernando Rouge Nunez, a senior economist at the World Bank. Fernando has been working at the bank in both research and operations, focusing mainly on transport, energy, and urban sectors, and providing overall strategic direction and technical inputs on operations and analytical work related to infrastructure, policy, economics, and financing. Fernando, please take the floor. You have 7 minutes. Thank you very much.
Thank you very much. Today, I will be presenting a quick summary about indicator 17.17.1, which the World Bank is the custodian. Next, please. Let me explain a little bit of the background about how do we got to this indicator. As you know, Goal 17 is about strengthening the means of implementation and revitalize the global partnership for sustainable development. And the indicator that the SDG was originally proposing was the amount of United States dollars committed to public, private, and civil society partnerships. At that moment, basically proposed an indicator that we were already collecting since 1990, which is the amount of United States dollars committed to public-private partnerships in infrastructure. And that indicator was the indicator that was endorsed. And I will explain a little bit of the rationale behind that. Please, next. Basically, for this indicator that we are proposing, that as you can see is much as narrow as the originally proposed by the SDGs. We basically is an indicator where we have been collecting since 1990, and basically we calculate and estimate this indicator, calculate basically in 139 countries since 1990, and we have data very recently. For example, now we just released the 2000 in May. We released the 2021 data, and it's publicly available. And so this indicator that we have basically is currently in tier 1, and it was basically agreed to endorse in the 51st sessions of UNSC. And as I said, the indicator is amount of United States dollars committed to partnerships in infrastructure. And let me explain a little bit more in the next, please. Okay, so we have a very well-established methodology. Was basically this started, as I said, in the 1990s, and I have been evolving over time. We have an advisory group that can help us to basically improve that methodology over time. Has a rigorous system of quality control, and we basically receive inputs regularly to improve the methodology. As I said, we go for an extensive internal review process, and the data is open for public review. When I said that, I mean anybody can go and challenge the data in two ways. You can bring a project that was not there and ask us to include the project, and if it follows the rules in the methodology, we will include that project, that PPP project. Or in the case that we have a project that shouldn't be there, we can also exclude it. So anybody can enter and challenge the data that is publicly available. The process is basically we have a team of researchers that gather that data. And it comes mainly from public sources, but also from commercial news databases and specialized publications and subscriptions for infrastructure in particular. That data is uploaded in an administrative website, and we follow a template. We not only collect that data on amount of US dollars committed, but we have another 30 variables. However, for this SDG, basically, this is the key one that we can contribute. Data is validated by a group of experts and is uploaded later in the public website. As I said, anybody can basically later go and challenge the data. And the methodology is available in the website. Everything is publicly available, and you can go basically at the project level to get the information about the data. So next, please. So we covered, as I said, 139 countries since 1990. These are the regions according to the World Bank. We will cover more, I'm sorry, most of the regions. The problem is that we don't have basically data on OECD countries or high income countries. So we cover low and middle income countries. The data is regularly updated semi-annually. So basically twice per year.
Sorry, Fernando, 2 minutes.
Yes, please. And as I said, it is in our website. Next, please. So just to finalize, basically, the data is available. What are the limitations that we have is that we only cover public-private partnerships, and we do not cover civil society partnership that was originally proposed as part of the indicator. And this is basically because World Bank, we don't have the experience to collect that data, neither the resources to do so. And the other important caveat that I think is important to mention is that when I say infrastructure, basically we cover energy, ICT backbone, transport, water and sewage, municipal solid waste management sectors. And we do not cover other sectors that sometimes are considered infrastructure, that's social and health, education and health, that usually are considered social infrastructure. We do not cover. There is no methodological constraint to expand those sectors. For us, has been mainly a question of budget constraints to do so, and need to guarantee certain level of quality of the data and sustainability over time. And the same, I would say, for the low and middle income countries. We concentrate on those. We do not cover high income OECD countries. And there is no methodologically constraint to expand to those countries. But unfortunately, since these are areas basically that go beyond our scope, at this moment, we do not cover those sectors. So that I wanted to finish with those caveats about our limitations. And thank you very much. Next, please. But I think, yes, thank you very much. And happy to answer any questions at the end. Thank you so much.
Thank you, Fernanda. And now we're going to have 10 minutes for questions for this session. I'm going to try to read them out from the actual chat. So hopefully our colleagues from the UNSD will help me if I'm actually missing them. There's been some chat going on. There's one, certainly a translation in French. I think that's been answered by the Statistics division, saying it's on YouTube, and there's a link there in terms of captions in French. There was a discussion between William and India, which is ongoing in terms of the COVID-19, so I don't think we need to go that one. So we then have a question coming in from Hi. She says, thank you, Joe. Thank you so much for your great presentation. Could you please comment on the resource required for CDE at different administration levels, national, state, and local, and what players could be leading the work? So that's a large question, but Joe, would you like to address that one?
Yeah, I have 3 points that I want to make. On the website that I posted on one of the slides, it describes the framework for the research plan that we're undertaking. I've heard the phrase research roadmap in some of the presentations. What we're doing is creating one. We've spoken to over 100 prominent data users from across the board, advocates, public policy analysts, economists, demographers, and we've taken that information, what we've heard, and we have what has emerged is an emphasis on partnerships. We need to move beyond the single survey approach for reasons that have been illustrated very well in this session. Then what we do is we create these use cases. On the website, you will see 3 big use cases on migration, on residential patterns for older populations, and for a fuller picture of employment through a better definition of what gig employment is about in the US. And in there, we address the other question that has emerged about how do you use these external sources of data? How do you acquire them? And the answer is, we're trying to identify now what it's going to take to acquire those. For example, from the private sector, the nonprofit sector. You can no longer confine yourself to government sources is the answer to that question. And so we have these use cases that are illustrate the curated data enterprise. And then finally, we're now meeting with technical specialists to construct pilot projects to illustrate and test things like curation, integration and linkage of data, dissemination and access. In other words, what is it going to take in practice to make this real? I'll stop there. Thank you.
Thank you, Joe. I see another one from Zaria. It's to the second presenter. That could be you, Joe, again. I'm not sure. Any challenges in accessing data and using other sources of data?
When I mentioned just before that we're exploring this as a research question right now. There are external sources of information that are out there. For example, cell phone detailed records for migration. There are models that have now been published to utilize these records, but we are exploring what it would take, in other words, for a government agency in the US to acquire large numbers of these records in order to integrate them into models of migration. And that's kind of the key here. And I want to emphasize too, that there's a whole issue involving confidentiality, the rules and laws regarding confidentiality of data. But record linkage is not necessarily what we're talking about. We're talking about integration of sources. For example, data could be used in the aggregate, anonymized, as has been done in other nations throughout the world now, to study migration and bring forward the study of migration here in the US by the US Census Bureau.
Okay.
Thank you.
Thank you, Joe. Then Natalia just indicating that Omar for Djibouti, its presentation is missing. The Secretariat might refer to this one. Is it missing? Do we have it?
No, I don't have it, Chair.
Okay.
Perhaps you can just, he typed something up in the chat, but maybe he can, if he wants the floor, he can elaborate.
Yep. If you'd like to take the floor, I can just keep going. There's some discussion going on with Harriet here. I think she's answered the questions coming through. Okay, so if Omar is there, if he has something that he'd like to present us, we can give him maybe 3 or 4 minutes if he's available and able to do it.
Hello.
Yep. Okay.
Oh, hi. Yeah, I just wanted to add one or a couple of things after the presentation of Harriet, which is the impact of COVID-19 on distribution and household and refugee household survey that we carried during the COVID pandemic. The results are available, as Harriet indicated, but I just also wanted to highlight that it's been since 2017 that the country has passed a law to integrate refugees population into the national development policy. So ever since, we've been exploring ways to improve the collection of data on refugees and IDPs, and this was for the Institute of Statistics an interesting exercise, because it was the first time that we carried a phone survey during a pandemic, and it was really full of learning lessons for us. And I also wanted to just mention that we are working with IAEG-SDGs, the Secretariat of IAEG-SDGs, to improve further the collection of data on refugees and IDPs, especially for our upcoming population and housing census. So there is a lot of great initiatives in that sense that I just wanted to add to the presentation made by Harriet. Thank you very much.
Kevin, you're muted.
Sorry, the dreaded mute. Sorry, everybody, the dreaded mute. Yeah, so I'm just saying that I'm not seeing any new questions that haven't been answered either directly by the presenters or from the floor in the chat. So we can keep on this agenda item for another minute or so, just in case anybody has additional questions or that they're feeling that they might raise or. Okay, so I'm not seeing anything else. Secretariat, is anybody there seeing any new questions that I haven't referenced?
No, Kevin, but maybe if Harriet wants to elaborate on determining the MPI for dimensions or indicators as they're covered around health and education.
Thanks, Harriet. Thanks, Heather. Harriet, would you like to take that point? Floor to you. Thank you.
Yes, sure. I didn't want to, of course, go into the technical details, but yes, the MPI indicators and dimensions overlap with some of the key dimensions of which the data was collected. And I've listed a few. Education, health is also another one. Access to services, access to food are other dimensions that where we have a series of questions that were asked and were monitored over time during the pandemic. So the data was collected for at least 2 or 3 rounds. during and in some cases now, I don't say after the pandemic, because from what I'm hearing, the numbers are rising again in some parts of the world, but during the peak of the pandemic. So yes, the data can be disaggregated in a way that one can calculate the different indicators that are normally proposed or proposed by the multidimensional poverty index. Of course, we also have, in some contexts, we also have information around security and around, which is also another dimension that I know that has now been discussed quite a lot in the inclusion of the MPI, especially in contexts where you have violence and conflict, and where often the displaced populations are residing. So yes, of course, the MPI, the indicators will vary from country to country, given the data that is available. Some countries, there are several more dimensions. The ones I listed initially were the broad ones that where all countries capture those ones. But as I said, in other countries, we have additional dimensions and indicators. So I'm happy to provide technical details or follow up with colleagues. But I've also posted my email in the chat, and I'm happy to follow up bilaterally with colleagues and participants. Thank you.
Thank you, Harriet. That brings nicely an end or a close to this particular part of the agenda. So we'll go to agenda item 3, which is the SDG progress and challenges, high-level political forum, goals and under review. So what we'll do is we will review the SDG progress and challenges for the goals, under review at the high-level political forum, starting with goal 4, with our first presenter, Sylvia Montoya from UNESCO UIS. Sylvia is the Chief Statistician of UNESCO since 2015, when she became Director of UNESCO Institute for Statistics. She has been leading the international education community in building consensus around the standards, methodologies, and indicators needed to measure progress towards Education 2030 and supporting regional partners and member states in shaping the monitoring systems for SDG 4. Like in the first section, please submit any questions you have in the chat. Sylvia, I hand over to you. You have 7 minutes. Thank you very much, Sylvia.
Thank you so much, and thank you for giving us the opportunity to share with you some of the challenges we have had actually in the last 2 years, especially regarding the monitoring, and that we're going to be sharing some also of the progress, because there are also some good news, and the education sector has also progressed very well towards the establishment of the definition of national benchmarks and the commitment from countries to actually to track and to monitoring the progress in SDG 4, and we're going to be sharing this in the first week of July. If we can go to the next slide, I will actually very briefly refer during these 7 minutes to the challenges regarding to the fact that to monitor in SDG 4, we just need to have different sources of information that serve to monitoring this progress. We're using management systems, students and teachers. We're also using learning assessment to track and to monitor the progress in learning and skills. And as well, we have to resort on household service and the capacity to yield data that is coming related to some other indicators like completion rate, and also allow to measure the level of skill in the youth and adult population. Each of the sources has faced very specific challenges, and then on top of that, we have also faced some emerging data demands that are actually associated to the characteristics and to the fact that the schools, as you may know, during 2020, most of the work has been closed, and since the end of 2020, as the health situation started to improve and vaccines are starting to be part of the options, then we have also have to change the system of measurement in some of the points regarding what is a full closure, what is a partial closure, what are some of the definitional issues that surround the measurement of SDG 4. If we can go to the next slide, please. This is the first actually take on the challenges that the country have had. The pandemic has affected unevenly the countries and their ability for reporting, not only for the global reporting, but also for their own capacity. Obviously, with low and low middle income countries facing much more difficulties, very severe ones, not only in terms of the capacity and in terms of the closure, in terms of the economic capacity, but also on the fact that also school closures has affected with the different kind of prevalence, the different countries and the capacity to address this situation. And this is actually clearly represented in this figure that has been actually collected by the UIS, by UNESCO at the beginning and during 2020 and the beginning of 2021. In different moments, we have follow up on this and try to identify how to support the capacity to reply. If we can go to the next slide. We also have detected that there are some variables and some kind of characteristics of the school system that has been collected much more intensively, and there are some quick methods of data collection that has been established towards looking at the electricity, enrollment obviously, and the different definition of enrollment in this new configure, in this new paradigm, the learner per class, the student attendance, the teacher attendance, and the water and hand wash sanitation, that are some part of the different components that needed to be understood in a particular way during these last 2 years in particular. And we have asked the countries about the frequency, and we have detected that those variables that are actually allowing to model policy responses were actually collected much more frequent than before the pandemic. If we can go to the next slide, overall, this is actually assessment of the status of the capacity of reporting of the countries. We have actually detected that at least half of the countries were having and are having some problems and difficulties in terms of keeping up to pace the reporting for the indicators that are in the global monitoring framework of SDG 4. Obviously, there are different sources and different feeds into those indicators, and we all know, and for this reason I am not getting into the household service, and in particular because all know that the 2020 was the year of the censuses, and censuses and household service has been particularly affected during these 2 years and has just recently started to recover. If we can go to the next slide. Please. This is one of the other sources of information. So we have the management systems, the household service. One very important source of information for education, obviously, are learning assessment and the capacity to understand how much are the students learning, how much they are progressing, how to design better pedagogical strategies, and how to deal with the difficulties that were happening during the COVID-19. We have had before the COVID-19, this is a map that has been built towards part of a partnership that the UNICEF, UNESCO, the World Bank are having regarding a learning data compact proposal. This is a coverage of learning assessment and the needs of data that are actually showing clearly our lack of data for some of the regions that are desperately in need to have information. During COVID-19, this has become much more visible. The need of data in some particular regions that were actually a characteristic of before the pandemic has been more visible, and this is actually helping now to support the learning in those environments. And I think that to some extent this is a kind of a good emerging issue that is coming from these 2 years of the pandemic. The fact that the need to measure learning has been uptaken by everybody, every stakeholder and every country, and for this reason we are seeing much more commitment towards the measurement of learning in this 2022 and on in terms of the participation in both international and regional assessment and the implementation of national assessment. So I think that to some extent we have to say that eventually for a kind of a painful reason, it has been raising the awareness to the need of understanding and measuring learning. If we can go to the next slide, just very quickly to try to go to the new demands of data. And I think that there I have to flag 2 points. UNESCO has implemented, and I think it's a very popular data collection in terms of the school closures, full and partial closures. UNESCO has kept track since day one of the pandemic about those statistics. But on top of that, UNESCO, UNICEF, OECD, the World Bank has put together an effort to try to avoid the burden on the countries in trying to collect data about the policy's responses to COVID, because we needed to understand what was going on in order to support and to help and to guide investment. And I have to flag that this service on policy responses, we are now administering the fourth wave with the same partners, has been an important source of information, but also a kind of a signal of the education community about our willingness to work together and to collaborate and to try to support and to react in an agile way about providing data in order to support the decision-making of our countries and our policymakers. If we can go to the next slide, I just want to briefly flag on the fact that 4 reports has been put together in terms, plus the information has been used in many reports and blog. Information has been collected through this partnership, and this show also some of the positive impacts that we have had about our decision to work together and to try to collect data together in order to try to be the most efficient and to be there to support and to provide information in a timely basis. If I can go to the last slide, and thank you for the time. The management system have been able to collect data, at least for the most important aggregates, and this is on track in general. It has been the need to redefine some concepts. For instance, what is attendance? What is in and out of a school? Plus new concepts that has appeared, such as partial and full closures. There was also a need to expand the metadata collection in order to understand and to record policy decisions that impact on data. We just need to understand what explains the data. For instance, the repetition and the promotion policies that the country has been implementing during these last 2 years and also in this current year. And it has been also clear the need to use non-official sources to understand the attendance and engagement of students and the emerging data demands. These are areas where all the organizations involved and the stakeholders, I think that we have made a good progress, and obviously is going to have an impact on, and we are keeping on our collaboration together. Thank you, and over, and thank you for the time. Over.
Thank you, Sylvia. Thank you for your presentation. The next goal we will focus on is goal 5. The presenter will be Janetta Ascona. Janetta is a research and data specialist at UN Women and one of the principal authors of UN Women's 2018 flagship report, Turning Promises into Action. She joined UN Women in 2010 to work on its flagship report, Progress of the World's Women. Janetta, you have 7 minutes. Please take the floor. Thank you.
Thank you so much, Chair. Good morning, good afternoon, good evening, everyone. I'm delighted to be here with you today. As we all know, women and girls around the world are facing many challenges. Therefore, my report back to you on the progress on SDG 5 does not, I'm afraid, paint a rosy picture. The hope, however, as always, is that by working together, by collecting data, reporting on these challenges, we can raise awareness and drive policy action. So what do the data reveal? This visualization you see in front of you was developed based on an assessment of the current level of progress towards achieving the 9 targets and 18 indicators and sub-indicators under SDG 5. Each oval in this picture represents an SDG 5 indicator value for a particular country. Blue, which you see on the edges, means target met or almost met. Green is close to target, and like a heat map, the warmer the colors, the worse off we are, with red representing very far from target. As you can see, we have too few blues and greens and too many yellows, oranges, and reds. And so really kind of flagging that we are not where we need to be in terms of goal 5. Next slide. Under the 2030 Agenda for Sustainable Development, the global community committed to achieving a very lofty goal, right? To achieve gender equality by 2030. But the assessment of progress to date tells us that the world is not on track to achieve the goal by 2030. The distance remaining to achieve the SDG 5 goal is long and the time short. In 3 critical areas to women's empowerment, equality between women and men in unpaid care and domestic work, women's rights and ability to make decisions regarding sexual and reproductive health, and the provision of systems at the national level to track funding going towards gender equality. In all of these, the world globally so the global aggregate, tells us that we are far or very far from the target. Only one indicator at the global level is quote unquote close to target, and that is women in local government. In other areas, for example, eliminating discriminatory laws and ending harmful practices, progress has been moderate. And hopefully you can see that in the bar here, but moderate is deeply insufficient if we're to achieve SDG 5 by 2030. Next slide. The regional and country outlook, perhaps not surprising, shows a lot of variability in the current status of progress. Also, importantly, in the availability of information. As you can see from this visual, no country or region comes out looking great. In fact, 1 in every 15 countries is very far or far from target in at least a third of the SDG 5 indicators. What also comes out clearly in this visual is a massive gap in data. The gray ovals that have been added to this visual represent the indicators for which we can't provide an assessment of the current levels because the data are either not available, that is to say they're not in the SDG global database, and so not provided, or too old to be used to assess current levels. Next slide. Data gaps are important. Where data are missing, women and girls are invisible. Gender data, despite improvements in recent years, remain inadequate. I started the presentation with a visual that showed what we know. This version that you see now in front of you combines what we know, the colored ovals, but also what we don't know. And that again is the gray ovals that you see. Only 48% of data needed to monitor SDG 5 are currently available. We need to do better. These data are essential to raise awareness about the barriers that women and girls face, and ultimately to improve the lives of women and girls everywhere. Next slide. Each year, UN Women and the UN Statistical Division collaborate on a report that not only looks at SDG 5, but also all 17 goals from a gender perspective, so all the other 16 goals. This is an example of an infographic that we include each year in the report that provides a quick look of the year's key findings per goal. There isn't enough time to go through all of these, but I wanted to show you that again, when we're thinking about, taking stock of where we are with gender equality, it's not only about where we are under goal 5, but really looking at all of the goals from a gender perspective. Gender equality, of course, is cross-cutting. In the next slide, we'll zoom quickly on goal 1. As we know, the impact of the COVID-19 pandemic continues to be felt across—
2 minutes, Janetta, 2 minutes.
Thank you. Key areas of well-being, including progress made on reducing on poverty reduction. These are the latest projections produced by UN Women in collaboration with UNDP and the University of Denver. And as you can see, the estimate is that some 388 million women and girls were living in poverty in 2022. The vulnerabilities that women face are unique and require specific policy action. And here, as part of this work, this modeling and kind of forecasting work, we also looked at different scenarios and what could be achieved through a comprehensive package that addressed and improved access to education for girls, access to family planning, that reduced kind of the pay gap and extended social transfers. And as you can see, the outlook is grim, but there is hope and there is a direction and a way forward that could really shift things in a big way. Next slide. I invite you all to go to the 2021 gender snapshot and the SDG 5 tracker. And so that's this new addition to the report that allows you to look at the qualitative and quantitative data associated with SDG 5. And so really an important addition that allows us to kind of tell a more comprehensive picture of where we are in SDG 5 at the global, regional, and of course, if you download the Excels at the country level. And of course, that all comes from the data that you all provide, that governments provide as part of this kind of follow-up and review process. The report is produced annually. The next edition is coming out in early September. And so do look out for that. If we can turn to the next slide very quickly. I also just wanted to bring you your attention to other work that we do in collaboration with with other UN entities, where we take a deep dive at some of the specific goals from a gender perspective. We've done an SDG kind of spotlight paper with the World Bank, with ILO, with UN Habitat. We're going to be having one in early 2023, looking at the gender and water nexus with UN Water. So stay tuned for that. And of course, if you want to learn more and download some of these publications and the data associated with them, I encourage you to go to our website, data.unwomen.org. I'll stop there. Thanks so much, Chair.
Thank you, Janetta. Apologies early on. I think my mic wasn't working for your introduction, so apologies for that. So thank you for your presentation. So now we have 3 presenters for Goal 14 on oceans. They are Kirsten Isni, Dorian Navarro, and Thomas Brooks. Kirsten is a program specialist at the Intergovernmental Oceanographic Commission of UNESCO since 2012. Her work on ocean carbon sources and sinks, trying to distinguish the natural and anthropogenic influences on marine environment. Dorian is a statistician with FAO's Office of the Chief Statistician in Rome headquarters, working on the 21 SDG indicators under its custodianship, including their annual reporting, development. He has consistently represented FAO at the IAEG-SDGs alongside the FAO Chief Statistician. As Chief Statistician in IUCN, Tom has responsibility for scientific support in delivery of knowledge products based on IUCN standards and for producing the periodic IUCN flagship report, Nature in a Globalized World. His background is in threatened species, conservation, and biodiversity hotspots. Ladies and gentlemen, you have 10 minutes combined. Please take the floor. Thank you.
Yes, thank you very much. My name is Kirsten Isni from the Intergovernmental Oceanographic Commission of UNESCO, and I'm here presenting 2 progress on 2 indicators for SDG 14. Next slide. And the first one is focusing on ocean acidification with the target minimize and address the impacts of ocean acidification, including through enhanced scientific cooperation at all levels. The indicator then in the end was reduced to the chemical changes only and not the impact so much. And there we have average marine acidity measured at an agreed suite of representing sampling stations. A very short phrase with a lot of words in the end, which require definitions, and kind of put it in a context. What does ocean acidification mean? And that is provided in the methodology, which was developed together with international experts on ocean acidification. In contrast to many of the other indicators, this is definitely nothing which was collected by member states on a regular basis before that, and therefore we are addressing the data collection from different angles. One is directly going to our member states, one is going to the experts, and then also in collaboration with other databases. Next slide, please. To facilitate the data collection, we developed a data portal, which you can see some snapshots here, and I invite you to visit the website, which has some very basic capabilities right now. You can upload data and metadata, which is very important there to actually define the quality of the data so that we can actually do this comparison of global data sets. And we can, localization and so on. To date, next slide, please. We used this platform through 3 years of data collection. As you can see, it really improved. And this is also due to hands-on training, which was, of course, due to COVID as well, a little bit reduced, really helping experts to learn how to measure ocean acidification in the field, but also having online trainings with national statistical offices, national oceanographic data centers. And we are now at 37 countries which submitted data and information, but we have over 300 stations, which is great. But we are still far away of being complete, which is also, even of existing information, which is also due to the fact that a lot of information is currently already, as mentioned, in other databases. And what we are trying to do now is, next slide, please, to set up a federated data integration and ingestion system where we can really base our information as well on the existing information which is already submitted to under other databases. We are also developing visualization tools embedded in the federated system, and we want to improve the ingestion format for our data platform. The information presented in the reporting, you can find it in the SDG annual report, but it's not only used there, it's also used in the annual WMO statement for climate, and also in the newly upcoming State of the Ocean report. Let's go to the next slide, the next indicator, which is for SDG 14.A. The target and the indicator reads proportion of total research budget allocated to research in the field of marine technology. Again, something which was not originally actually collected by member states on an annual basis. And so we established a process, next slide please, with the Global Ocean Science Report, which serves as a resource for policymakers, academics, and other stakeholders to assess really progress towards SDG goals under the 2030 agenda in the framework of ocean science. And I invite you to go to this portal, and there we also have information, of course, on the indicator, but on many other parameters like women in ocean science. Next slide, please. Again, we have they're facing a few problems as well in getting the data. So far, we have 27 countries responding to our requests. It's just because ocean science as well, the funding comes from very different sources, different ministries. And so we are trying to go on this road. Here you see the result presented in the last Global Ocean Science Report in 2020. And you see that on average, only 1.7 of national research budgets are allocated to ocean science. And that really has wide ranges. And if we compare it to the benefits provided by the ocean, this is really not sufficient. Next steps are there. We are preparing next year. We will start for full Global Ocean Science publication 2024-2025. However, to reduce as well the time lag between the reporting periods, we will have shortened questionnaire to be sent to our member states this autumn, which will include information on 14.8.1. We will use the same questions to facilitate the reporting. And all that, of course, is as well then contributing to some of the reporting and measuring the success of the UN Decade of Ocean Science for Sustainable Development. Thank you.
Okay. Thank you, Kirsten. Isinsi, of course, pronounced your name incorrectly. Okay, I apologized earlier on to everybody if I stumble over people's names. So now, next presenter is Dorian or Tom. Would you like to take the floor? Now we're actually quite tight for time, so can I ask you to keep to 3 minutes, please? Thank you.
I'll do my best. Thank you.
Thank you. Thank you, Dorian. Very good.
So we're looking at indicator 14.4.1, the proportion of fish stocks within biologically sustainable levels. This is an indicator tracked since 1974, was also used for the MDGs, and has traditionally been reported only at global and regional level, although we have introduced a new method for its reporting at national level. So let's look in the next slide at the global picture as far as the distance to the target. So how is the world, what is the current status of the world with respect to the target of having sustainable fish stocks? As you can see, it's very far from the target, and most marine regions are in the red. In the next slide, we can see that not only are we far from the target, but we are also moving away from the target. Again, looking at the trend, most marine regions are in the red, and only very few are sort of stable or improving. Next slide. Indicator 14.7.1 is the sustainable fisheries as a percentage of GDP. This is a new indicator. It's linked methodologically to the indicator that we just saw, 14.4.1. And of course, there are several constraints in country reporting. In the case of this indicator, we don't have a numerical yardstick with which to assess the current distance to the target, and therefore we can only assess the trend. So as we will see on the next slide, we have generally a slight deterioration at world level. Of course, we have a map here with the different country progress. Some countries, of course, are improving, but the overall picture is one of slight deterioration since the baseline year, in this case, 2015. Next slide. We move quickly to two indicators that are of a more procedural nature, more means of implementation type indicators on the degree of implementation of international instruments to combat IUU fishing on the one hand for indicator 14.6.1, and to promote small-scale fisheries on the other hand in the case of 14.B.1. Both of these indicators are the data is collected through the Code of Conduct on Responsible Fisheries questionnaire sent to countries every 2 years. And the next
Sorry, Dorian,
slide,
just 1 minute if you can. Thank you.
And the next slide, we see that for 14.6.1, the world is close to the target. So countries are taking measures to combat IUU fishing. And the next slide, they are also improving over time in taking these measures to combat IUU fishing. Next slide. In terms of taking measures to promote small-scale fisheries, it's an even better situation. At world level, the target is already met, we can say, although we shouldn't forget that there are many gray countries on this map with no data, many of these developing countries. So that should be taken into account. Next slide. Of course, when the target is already met, both the current status and the trend is the same. We can say that the target technically is already met for this indicator. Thank you.
Thank you, Dorian. Tom, you're next. I must keep it to 3 minutes this time because we're running slightly over. Thank you, Tom.
Many thanks indeed, Chair, and good day to friends and colleagues around the world. I'll say a word or two about progress with indicator 14.5.1, coverage of protected areas in relation to marine areas. That is an indicator of the degree to which important sites for nature in the marine realm are being safeguarded. This indicator is derived from an overlay of nationally reported data from the World Database on Protected Areas and the World Database on Key Biodiversity Areas. It has universal country coverage. It encompasses data from all countries, but it does have some important constraints in national reporting, especially as relates to other effective area-based conservation measures, which have not yet been widely documented, and for documentation of important sites for nature, key biodiversity areas, beyond the subset of important sites for birds. Next slide. And to highlight just 3 key messages from the 2021 reporting here. First of all, we find that on average, only about half of important sites for nature in the marine realm are safeguarded. Over half are not yet protected. We find a quite wide variability between regions, something that a number of other presenters have highlighted. But we do find some good news. There have been consistent increases across nearly all of the world's regions over the last couple of decades. That's all from my side. Thank you, Chair.
Thank you, Tom. Thank you. Okay, so thank you, everyone, for that. I think we're going to be moving now on to our next presentation. So that's thank you to Kirsten, Dorian, and Tom, of course. So I think Tom and Dorian, I think you're up again for goal 15. Yeah, you've got 8 minutes on this one. Okay, thank you. Please take the floor. Sorry, Dorian, you're taking. Oh.
Yes, I'm waiting for the slides to appear. Okay, so let's begin with the first indicator under goal 15, which is a traditional indicator on forest area as a proportion of total land area. This was also an indicator used for the MDGs and has a long established data collection and reporting process. We have almost universal country coverage, although we have some country reporting constraints that we are of course, working with countries through different capacity development initiatives to try to address. In the next slide, we will see the global situation for this indicator. Of course, here we can only look at progress over time. There is no numerical yardstick for forest area. We cannot establish one single target for every country due to their different bioclimatic situations. But the trend is one of deterioration since the baseline year, in this case 2015. And we see many countries in the red, and many countries with slight or no improvement, although some have registered some improvement. Over to Tom for the next indicator.
Thanks again, and hi again, everybody. So this is to say a word or two about indicator 15.1.2, which is another indicator of the safeguard of important sites for living nature. Its derivation is in the same fashion as indicator 14.5.1 as just described, with IUCN and UNEP WCMC serving as the official custodian agencies for the indicator, and drawing data from the nationally reported data served through the World Database on Protected Areas and World Database on Key Biodiversity Areas. I'll emphasize here that while the high-level comments on country coverage and constraints in reporting are broadly similar to those mentioned under 14.5.1, the aerial extent of coverage of this indicator is wholly complementary to that described for marine, with 14.5.1, of course, covering marine areas, 15.1.2 here covering terrestrial. Next slide, please, have a look at the results. So a couple of key messages here from data over the last couple of decades. Again, we see wide variability between regions. We see increases, but maybe not to the level that we've seen in marine, reaching just over 40% coverage in total around the world. But maybe the key, the overall key message here, and really rather worrying one, is that progress seems to be stalling, that we've seen a flattening off of the curves of increasing safeguard of important sites over the last 2 decades. Many thanks. Back to Dorian.
Thank you. And we're at 15.2.1, which is progress towards sustainable forest management. This is an indicator comprising 5 sub-indicators capturing the principal aspects of sustainable forest management. This is a new indicator, so compared to what we saw before on forest area, this is a new indicator introduced in the SDG agenda. Similarly to 15.1.1, we cannot assess the current status, but only look at progress over time. And to do that, we use a dashboard on the next slide to assess changes over time for the 5 constituent sub-indicators. Contrary to the pessimistic picture about forest area in general, here we see a bit more of an optimistic picture. So measures towards sustainable forest management are generally improving. There is a deterioration in forest area, but at least the rate of net forest loss is decreasing. So that's, let's say, one of the potential areas of hope in the otherwise bleak landscape for environmental indicators. Next slide, I think it's over to Tom.
Many thanks again. I'll be really quick with this one because indicator 15.4.1 is a perfect disaggregation of indicator 15.1.2 as described already, simply derived by overlaying a standard layer of mountains following UNEP WCMC's definition onto the indicator of safeguard of important sites. And this is because of the disproportionate sensitivity of mountain biodiversity. Next slide, please. And the pattern, the key messages which emerge for the mountain specific indicator of safeguard of important sites are again similar, wide regional variation, regional increases in coverage up to about 40% globally. But again, a rather worrying pattern of stalling progress over the last 5 years or so. Many thanks. Next slide.
So we come to 15.4.2, the second indicator concerning mountains, and this indicator looks at the mountain green cover index. Similarly to 15.4.1, just presented by Tom, we use the UNEP WCMC mountain map of the world and overlay that with land cover data derived from geospatial data to track changes in land cover in mountain areas specifically. We can move to the next slide to have a look at global progress. We don't have a numerical yardstick for this target. It's difficult to assess current status, but we can measure progress over time. And what we see clearly on this map is a preponderance of the slight or no improvement category for most countries, which is reflected also in the world assessment. So slight or no improvement since the baseline year, in this case, 2015. Thank you. Next slide.
Moving on to indicator 15.5.1. So this is an indicator of the extinction risk facing the world's species. It's derived from repeat assessments of species extinction risk from both the IUCN Red List and from national red lists where these are available. It has universal country coverage because IUCN Red List data encompasses data from all of the world's countries. However, relatively few countries yet have repeat national red lists, and taxonomic coverage of these can be quite narrow. More generally, while taxonomic coverage is near comprehensive across vertebrate species, coverage of many other species groups, invertebrates, plants, and fungi remains quite low. A final key constraint, and one that there's extensive work underway to overcome, is to strengthen the interoperability between national and global red lists, harnessing a tool called SIS Connect for national to global data exchange. Next slide, please. Very quickly to highlight 3 key messages emerging from consideration of the Red List Index. First, we find
can we go with 2 minutes, please?
Extensive prevalence of extinction risk across the world species, with more than 1/4 of species assessed threatened with a high risk of extinction in the medium term. As we've seen with many other indicators, we see wide variability between different regions and different countries. And most disconcertingly, most worryingly, we find persistent deteriorations across all regions, with about 10% declines over the last 3 decades. Many thanks. Next slide, please. I'm going to go for this one as well. So this is a response indicator of policy responses to the threat of invasive alien species. Responses in terms of policy, of legislation, and of funding to address invasive alien species. It's derived by surveys to national statistical organizations and environment ministries, undertaken by IUCN's Invasive Species Specialist Group. It has quite broad coverage. 142 countries provided data in response to the most recent survey. And crucially, I'll emphasize that this is a response indicator. The adoption of legislation and existence of adequate resourcing does not necessarily indicate successful implementation or impacts on the ground. Next slide, please. One key message here. So key point here is that while there has been over recent years very broad adoption by nearly all of the world's countries of legislation preventing or controlling invasive alien species, only about 1/3 of those countries have environment-specific invasive alien species legislation. Most of the invasive alien species response in place is focused specifically on the subsets of plant and animal health. Many thanks indeed. Next slide.
Okay, thank you. I see the thank you slide there. So thank you, Tom and Dorian. Now we have a little bit of time for some questions. I see one question, which is coming up in relation to 14.4.1. So it's okay. So it's any effort to provide capacity building for indicator 14.4.1. I think that's come from Nazaria. So Dorian, would you like to address that one? Thank you.
Yes, thank you, Chair. I haven't seen the question. I haven't had time to open the chat, but I can assure the colleague that FAO is indeed providing capacity development support on this indicator, particularly, as I mentioned very quickly in my presentation, on this new methodology that allows countries to report on their level of fish stocks at biologically sustainable levels. We have also prepared an e-learning course. We have a lot of supporting material on that. And we have organized a number of regional and country trainings to that effect. Thank you. I hope that responded to the question.
It did. Thank you very much. Now, I don't see any other questions, but there's been some discussion. Okay, I see one. Okay, Tom is leaving. Thank you, Tom. There's been some questions in terms of the availability of the presentations, and I think we have here from our colleagues in the Stats Division, recording presentations will be posted in the event. So there's a link in the chat there for people who are interested in that. So literally all the information that was presented today and the recording of our meeting will actually be there. So if there was something that was misunderstood or not fully understood or would like to be followed up bilaterally, all the information is there for people to be able to take that opportunity to do that. Okay, I'm not seeing. Okay, so Tom Brooks, of course, he needs to go, but he's saying if anybody has any questions on the 14.5.1, 15.1.2, 15.4.1, 15.5.1, and 15.8.1, please free to email me, and his address is there. The 15.4, certain that mountain greenery index is of interest to me from co-chairing the WGGI. It's an area that we're actually looking to evolve expertise and develop some knowledge and do some capacity building in terms of knowledge transfer to UN member states on that. So of course we're working closely with FAO on that. So that's an area of keen interest to me. I don't see any other questions, and I see the time. We're just on time now again, so thank you. So I might just say on behalf of the IASDGs, we would like to thank all the speakers for their participation and also all the attendees for joining us today. As a reminder, all presentations and recording will shortly be posted on the event page, which I just discussed. Our next meeting will be the 13th IAEG-SDG meeting, which will possibly take place in person in mid to late October. The Secretariat will send out information in advance for this meeting once finalized. And all I can say is thank you again, and please keep safe, and thank you for the Secretariat for all their hard work in the preparation of this meeting. So thank you very much, and apologize to all the people who I mispronounced their names. I see Kirsten there. Okay, so thank you everybody, and have a good morning, good afternoon, and a good evening. Thank you very much. Bye-bye.
Thank you. Bye-bye.
Thank you.
Bye.
Thank you. Bye. Thank you. Bye.